Vanakkam. Greetings from K.S. Rangasamy College of Technology, Tiruchengodu. Myself, Mrs. S. Chandralekha, working as Assistant Professor under Department of Mechatronics Engineering. Today, we are going to see a module under the course Industrial Health. The contents are types of hazards and the effects due to that hazards and medical examination. Learning outcomes. The learner will be able to understand and classify the hazards. The learner will be able to classify the health effects. The learner will be able to know the significance of medical examination. The types of hazard. Normally, the hazards are classified into physical, chemical, biological, mechanical, electrical, and ergonomical hazards. But as far as today's technology is concerned, that has been refined as safety hazard and work organization hazard. So generally, under physical hazard, the external things, say like noise, vibration, temperature extremities, hot and cold environment, and the radiations, all these things falls under physical hazard. Chemical hazard, under chemical hazard, all the chemicals, whatever chemicals we use in the industrial processes, that may be a raw material or else a cleansing agent, whatever it may be, that will fall under the chemical hazards. And biological hazards, it is the infectious or pathological things that is used in R&D labs or other things that will come under the biological hazard. Even the pandemic scenario, that COVID-19, so that also falls under this biological hazard or biological threat. And next one is safety hazard. The industrial slips, trips and falls, faulty equipment, all these fall under the safety hazard. And ergonomical hazard is that is mainly dealt with the work posture and the working conditions, the repetitive task, awkward posture, lifting the load or else outreaching for some other activity, that will fall under the ergonomical hazard. And the final thing is work organizational hazards. So things that cause stress, anxiety, fatigue, all these things fall under work organizational hazard. So I'll just repeat. The hazards are classified into physical, chemical, biological, safety hazards, work organizational hazards, and ergonomical hazards. Normally, accident is caused by two factors. One is unsafe act, which is the major contributor, and next one is unsafe condition, that is a minimum contributor. But these unsafe condition that is caused due to this hazard, because hazard, it has some inherent property. It may be a physical or chemical or biological, ergonomical, safety hazard or work organization hazard that has an inherent property to harm people, property as well as the environment. So these hazards, they contribute to the unsafe conditions that may lead to the some sort of, that will be associated with the unsafe act of the worker, that will lead to an accident. So accident, sometimes it may be a near miss, minor injury, major injury, sometimes it proved to be a fatal one. So based on this hazards, what are the effects the workers are going to face? If it is a physical hazard, say for example, if it is a physical hazard, a sudden exposure to a physical hazard, a noise, a temporary sort of disturbance will be there. Say for example, in Diwali time we will be bursting crackers. So when we burst this atom bomb, we'll just get that temporary, a short-term deafening in our ears. So that sort of effect is called as acute effect. When we listen to that sound decibel for continuous 8 hours and it is prolonged for years, then that will be a chronic effect. So as time goes, we will lose our hearing capacity. So this is how it is given here. The effects, acute effect is immediate effect, and chronic effect, again it is written as chronic effect, it is a delayed effect. So acute effect, it immediately reflects back, and the chronic effect is delayed, that is happened due to the long-term exposure. So when we compare these two effects, acute effect involves high exposure over a short period, and whereas chronic effect, it is a low exposure over a long period. And acute effect can be minor or severe depending upon the hazard, depending upon the exposure they are. And the chronic effect, still some cases are not still known. Maybe research is also going on. In acute effect, the symptoms are very obvious, but whereas in chronic effect, it is very difficult to establish the relationship. And the occupational diseases. Based on these hazards, physical, chemical, biological, ergonomical, safety and work organization hazards, the Factories Act 1948, framed by our government of India, under Schedule 3, they have given a notifiable diseases. These are the diseases caused due to the industrial working conditions. To name a few are anthrax, noise-induced hearing loss, dermatitis and occupational cancer. And industries, they have a separate set of occupational health center. Say for example, in our terms, we can just tell it as a clinic or a dispensary where a nurse will be available anytime to attend the needs of the industrial workers. That may be a first aid case or minor injury. Sometimes if it leads to major injury, the duty doctor will be called for, or else the concern, based on the severity, the concerned worker will be taken to the nearest hospital. Then medical examination. This is the very important part among the industrial health. Normally, whenever we recruit people, industries, they will do this pre-employment examination to analyze the fitness of the worker, whether he or she is fit enough to proceed with that job. So fitness is done for this particular, the medical examination is done to assess the fitness of the worker. And another thing is, the main intention of these medical examination is to identify whether they are exposed to some other sort of hazards or some other sort of, either maybe a previous medical history, maybe they would have undergone some surgery, or they would have been working in some other industry and some other process that would have affected them. So for that case, to analyze their health status, these pre-employment examination is taken. After that, after some 3 months or 6 months, after joining in the company, post-medical examination is taken and the comparative analysis is done whether the health status of the worker is maintained, sustained or not, whether there is any problem is faced by that particular worker. That is the prime intention of these medical examinations. Okay, fine. Thank you. We'll see in the next module. Vanakkam.